Hi, I'm James Johnston, Transformation Manager and Lead for the Health and Care Staffing Act in East Dunbartonshire HSCP. Today, I'm sharing an update on a digital tool I've developed for tracking service risk scores and real-time staffing assessment and escalation, which has been developed in line with the Health and Care Staffing Scotland Act 2019, which is seen here, and the related statutory guidance, which can be seen here. This vlog will walk you through our local solution, its impact, and how it supports assurance and decision making across our partnership. As you know, the Health and Care Staffing Scotland Act 2019 sets out clear duties for all health and social care providers. Specifically, the duties 12IC, 12ID, and 12IE require us to have robust processes for real-time staffing assessment, risk escalation, and arrangements to address severe and recurrent risks. Part 5 of the statutory guidance reinforces the need for digital solutions to support these duties with platforms like SafeCare recommended. However, in the absence of SafeCare, I've built a local process to support compliance and assurance. To meet these requirements, I developed this Microsoft form that collects weekly RAGG ratings for both standard service and real-time staffing ratings. This replaced what was our previous weekly flash meetings, which often lasted up to 40 minutes. The form's quick, easily accessible, and ensures consistent data collection across all services each week. As you can see here, the form records the service submitting, the date, the submitter, and the RAGG ratings, and also comments for any amber or red responses. The same form link is used each week, so no additional work is required. The information then feeds directly into a tracking Excel file, which I'll share next. This solution was developed using quality improvement methodology and a series of PDSA cycles, which helped fine-tune the process for weekly use and has now been in place in East Dunbartonshire since March 2025. We tested, refined, and adapted the process based on feedback from service leads, ensuring it was fit for purpose and aligned with the statutory guidance. This approach helped us to streamline data collection and also improve the reliability of service risk assessments. Form submissions are automatically imported into this spreadsheet into a query tab. They are then automatically fed over into the weekly tracker tab. I've blacked out service and submitter details here, but you can see how the data comes through in terms of date, ratings, and any comments for the amber or red responses. On the weekly tracker tab, you can see how the RAGG for service rating and for real-time staffing are tracked week to week. It provides a clear overview of risks across the system, and this visualization supports productive discussions at both our fortnightly SMT and our operational response group meetings. It doesn't replace business continuity and the escalation processes which are currently in place. Heads of service would already be aware of any risks as they arise. Initially, the tool was designed to support and shorten our flash meetings, but as the process matured, we were able to reduce the meeting frequency from weekly to fortnightly and eventually managed to stop them altogether. The digital tool now provides sufficient data for assurance, enabling more focused and productive decision making. As I said, it hasn't replaced the standard business continuity or our usual escalation routes, but rather enhances our system-wide risk oversight. Our approach is fully aligned with the statutory guidance and the local SOPs. The escalation process follows all of the recommended steps with daily huddles, risk mitigation, escalation to senior decision makers, and monthly reviews of any severe and recurrent risks. We use the national RAGG, the RAGG classification, which was included in the form I shared a short time ago to support completion, to record all escalations and mitigations, and to ensure transparency through DATIX reporting when required. Our next steps include ongoing refinement of the tool, further integration with our business continuity processes, and continued engagement with staff to ensure that the system remains robust and responsive. And we're already looking at ways to add to the form to cover confirmation of local escalation. Thank you for watching. If you have any feedback or questions about the tool or our processes, please get in touch. All input is invaluable as we continue to improve the approach to staffing risk assessment and escalation. I'm more than happy to discuss and share any of the tools that you've seen in the hope that they might be able to support other HSCPs or services. Thank you.